Hi, my name is Tamara Randall, and I'm a student at Arizona State University completing the MSW program. And the presentation that I'm about to give today is about person-centered therapy and ISTDP. So the following presentation includes two activities that I completed during my second year field placement at a Stanford Health, which is a private counseling company that provides adult individuals, couples, and families that experience anxiety, panic, depression, relationship difficulties, and other mental health issues psychotherapy services. So through the practice, interns are given multiple opportunities to meet the requirements of their second year advancement generalist social work field placement and the opportunity to provide one-on-one psychotherapy sessions with adult clients. In this presentation, I demonstrate two therapeutic modalities that I practiced during my second year placement, and those are the person-centered therapy and intensive short-term psychodynamic therapy, which is ISTDP for short. So a little bit about this therapeutic interventions. Person-centered therapy focuses on the client's positive potential to rely on the internal resources to resolve conflict. It believes that the client can resolve their own issues. It provides a positive environment with opportunity for growth and personal development. It's an indirect therapeutic service that helps clients feel empowered, because if they have greater chance at recovery and self-actualization, they tend to do better and have long-lasting effects. The intensive short-term psychodynamic therapy, the ISTDP, helps clients overcome the internal resistance that is keeping them from experiencing true feelings about the present and the past. It focuses on the defenses that the client is using to avoid their feelings that have been repressed by the ego because they're either too frightening or too painful. And the goal of ISTDP is to help clients overcome these unconscious defenses so they can experience their true feelings. The following slide represents my first activity with my first client. I conducted a meet and greet with the client when he was first referred to me, and that lasted about 30 minutes. And then we met for the first initial therapy session. I write this part in third person as a case vignette because I want to showcase my documentation skills, and later on we will go into application. Okay, so I will go ahead and just go read this, and then I'll talk some more at the end. So the client presented to initial therapy session motivated to start. The client and therapist reviewed confidentiality policy, informed consent, and client provided therapist with permission to record session. The client is a 22-year-old Hispanic male, presents well-groomed with casual attire, presents with chief complaints of depression and relationship disturbances in the context of recently having gotten out of an emotionally abusive relationship with a female and possible family of origin issues. Client affect was positive and reports that he was doing better than 2 weeks prior when client last spoke with therapist during the meet and greet. Client reports that he recently got news that his ex-girlfriend, whom client broke up with 3 months ago, is already involved in a new relationship. Client and therapist discuss feelings and thoughts regarding the situation. Client reports that it made him upset and confused. Therapist asks client what he hopes to get out of therapy, and he responded, "I just want to get back to the way I was before in terms of finding myself without having the dark cloud over me or my past toxic relationship. I would consider it toxic now that I think about it." Client and therapist explore examples of unhealthy patterns. Client disclosed that his ex-girlfriend lied and was unfaithful to him. These events led client to feeling betrayed, insecure, impotent, and increased trust issues. Despite these events, client stayed in the relationship for 2 years. The clinical skills that I demonstrated here were ability to provide informed consent, confidentiality per HIPAA regulations, which I also excluded personal information and name to protect his identity. I inquired and gathered information. I established rapport. I provided documentation, and I mainly established a therapeutic relationship. The applications are how I applied center therapy here. For this project, my role was the therapist. The client presented for therapy due to a recent breakup. Due to the way things ended, the client's self-worth was damaged. Client shared with me that his ego had been crushed because his ex-girlfriend lied and was unfaithful during the relationship. Using the person-centered approach, I created a safe space for client to talk openly about his issues, displayed empathy. I provided validation, provided reflective listening, and used a non-judgmental approach. Client expressed to me that the dark cloud consisted of ruminating about his ex-girlfriend, avoiding talking about his feelings, and needing his ex-girlfriend to own up to what he did. The client was able to identify after the therapy session how his own thoughts and behaviors regarding the way he handled the situation created an extra layer of pain and kept the client from moving forward. Towards the end, the client's perceptions were shifted from external locus of control to an internal locus of control. This created a positive insight view of self as client was able to embrace the experience and open himself up to learning how to better himself and his future relationships. After this session, I reviewed the video with my supervisor and went over the areas that I can improve and things that I need to work on with client for the next therapy session. In theory and practice, the humanistic approach is the one that guided my practice. The humanistic approach states that human beings are intrinsically motivated to move towards a positive direction of growth and improvement. The humanistic approach highlights the dignity and worth of the clients and emphasizes that every person should be acknowledged and validated. The person-centered modality is informed by the humanistic approach because it focuses on the client's positive potential, rely on their internal resources to resolve conflict, and ability to resolve their own issues. And again, when we provide a positive environment with opportunity for growth and development, clients will feel empowered to have a greater chance at recovery and self-actualization. The intervention level that I use here was micro, and in micro, social work provides direct services, interventions, and support to individuals, families, and groups in a variety of settings such as healthcare, mental health, and school facilities. I provided direct services to this individual who came in with a presenting issue. Me and the client completed an assessment, agreed on treatment goals, and the intervention that I was going to be used, which was a person-centered therapy. I used the skills that I gained through my studies and at my internship and provided the client with therapy services. This is all micro work. The core competency that this entails to is engage with individuals, families, groups, organizations, and communities. Social workers must learn and build the necessary skills to apply evidence-based interventions that are going to benefit and be in the best interest of the client. So for this core competency, I engage with in this individual who, again, he came in with a presenting issue, and I used my skills that I have been learning and provided the person-centered therapy, which is also an evidence-based practice. So the self-reflection is basically what I learned, and I realized now this was my very first therapy session, that I learned so much from my first session to now. Recording the sessions and reviewing them with my supervisor has taught me the areas that I am strong in and the areas that I need to work on. Watching myself in action and having a discussion back and forth with my supervisor was also very helpful. It helped me see and understand the things that I need to pay attention to when working with clients and the things that I missed during the sessions. And having my supervisor's perspective helped me imagine, and him providing me his input, what I could have said at that moment. And I made me wonder which direction the session would have taken. This activity helped me gain skills that I need when it comes to relating to clients and learn how to think clinically. I've been getting really good feedback from my supervisor and feel confident in most areas, but my plan is to perfect my skills, my progress notes and documentation, and seek help from my future supervisors as needed. For the activity 2, I did evidence-based practice research on ISTDP before I decided to apply the model. Some of the findings that I found out is that results of the meta-analysis studies that were published in 2000 and 2021 demonstrate the efficacy of short-term psychodynamic psychotherapy, STPP, in specific psychiatric and somatic disorders. Results concluded that patients treated with different forms of STPP are better off regarding their target problems than 92% of patients before therapy, and at 13-month follow-up, they were better off than 95% of the patients. And so basically, STPP was significantly superior to no treatment and treatment as usual. However, I didn't find any differences between STPP and other forms of psychotherapy, but it was okay because I was just going to use the ISTDP. The patients with somatic disorders showed a significant reduction in somatic symptoms and hospitalizations after receiving STPP, and a decrease in secondary outcomes such as depression and anxiety that cause functional impairments. The literature review results supported that ISTDP is an EVP and showed significant improvement of symptoms, interpersonal problems, and reductions in hospital costs. So for this project, my role was a researcher, and I researched the ISTDP model and conducted EVP literature review on ISTDP. My objective was to demonstrate that ISTDP is an effective evidence-based psychotherapy, is strongly supported by current clinical research studies, is cost-effective, and provides long-lasting effects for the patients. I selected a client from the previous therapy session. I reviewed the video, I wrote up the transcript, and discussed with my supervisor how I would apply ISTDP models, principles, and techniques with that client. I analyzed the transcript and informed my supervisor that based on the client's affect and nonverbal cues, the client appeared to have a decent ego, adaptive capacity, and ability to tolerate anxiety, as evidenced by a striated skeletal muscle tissue, which is signaling like when he signs, and the rhythm, hand wriggling, and good eye contact. The client's defensive structure appear organized around repressive defenses, including tendency to take a use and abuse position in relationships. His strengths included high motivation to address his problems and psychological mindedness. The client can cognize and provide meaningful information regarding painful situations that he experienced during the unhealthy relationship related to the problems that bring him to therapy. However, the client was not able to get an intrapsychic focus. An intrapsychic focus emphasizes unconscious motivation, which means that the causes of emotional disturbances frequently come from inner issues that stem from conflicts with early attachment figures. An intrapsychic focus would have removed the client from the victim's position and places the client in the driver's seat and helps the client assume the role of master of their own universe. During this session, he did not quite get the intrapsychic focus. So what I suggested, I explained to supervisor that throughout the session, client focus on external conflicts, thoughts, and ideas instead of feelings. And I suggested a graded format of ISTDP where interventions such as clarification and challenging defenses are used to help resistant clients distinguish between feelings, anxiety, and defenses. And then once a client has an intrapsychic focus and understands the cause that his defenses have on his functioning, I can proceed with other ISTDP interventions, such as pressure, head-on collision, and transfers of the unconscious therapeutic alliance. The theory and practice that I use for this activity is that I base my practice on was the psychodynamic theory, which is developed by Sigmund Freud, and it focuses on psychological unconscious forces that underlie human behavior, feelings, and emotions, and create intrapsychic conflicts. And these emotions and behaviors are usually related to the client's early experience and trauma. And ISTDP is informed by the psychodynamic theory because the client's behavior is motivated by internal psychological forces. And again, the goal of ISTDP is to help the clients overcome these unconscious defenses so they can experience what they're truly feeling inside that they have been storing in the unconscious. The intervention level for this activity was micropractice, and in micropractice, social workers work one-on-one with clients, assist in developing appropriate treatment plans, and use research to find evidence-based practice, EBP, and interventions that are culturally appropriate and best fit with the client's presenting issues and needs. And so that was the whole goal of why I conducted a literature review of meta-analysis studies that were published in 2004 and 2021 to find out the efficacy of short-term dynamic psychotherapy and to showcase that it was appropriate to use with this client. The core competency is engage in practice-informed research and research-informed practice, and competent social workers need to engage in informed research to build critical thinking skills and gain experience through practices that show scientific proven and pertinent methods that will best address the needs of their clients. And that's exactly what I did. I conducted the literature research and I engaged in informed research practice. Okay, let me see. Okay, so for the literature review, during the literature review, I learned a lot. I was able to practice and implement some of the therapeutic skills and interventions that I learned in books that I read during my internship, such as Reaching Through Resistance. I read tons of ISTDP articles. I attended multiple ISTDP trainings. I watched patients' videos. And all the things that my supervisor taught me during my internship. During supervision, my supervisor and I engaged in a series of role play exercises so I could practice my skills. And all the skills that I learned in this project increased my confidence as a therapist. For the future, I plan to continue to research EVP interventions, seek supervision frequently and as needed, and continue to practice ISTDP so I can think psychodynamically and use the model appropriately during future sessions. During the supervisions, my supervisor provided me really good feedback, and these are basically like I quoted him. He felt that my strengths, specifically during the first session, is that I worked hard to help the client, and some of the reflections were excellent. And he said that for my very first therapy session that I did fairly well. The areas that I needed to improve in, he mentioned that I need to work on staying present with the client, maybe less nervous, listening deeply instead of getting ahead of the client while trying to implement a technique and trying to fix the client. He called this the writing reflex. And he said if I could practice this, it would serve me and the client better. And he said that once I slow down, I take the time to really get clear on the nature of the problem, that my work improves, and that this will help me listen and pick up on when the client is trying to point me in the right direction, and that I will be better equipped to describe to the client what I'm observing while being genuinely empathetic. So basically, slow down. Instead of being anxious to do a technique, that me and the client will be served by slowing down again, deeper listening, and not trying to solve a problem without first understanding the nature of the problem and having the therapeutic task be clear to the client, and that this will allow the client to be in the driver's seat instead of me. So I tended to get ahead of the game. And this is my supervisor, Johannes Keating. So basically, this presentation demonstrates how I acquire skills, I develop strategies, I use theoretical perspectives to guide my interventions and practice, and the knowledge that I gained about the social work profession through the activities that I completed during my second year placement. And I was able to demonstrate knowledge and applicability within the domains of microsocial work by providing direct services to a client and conducting evidence-based practice literature review on ISTDP to demonstrate the efficacy in patients who suffer from psychiatric and somatic disorders. This experience helped me become a more proficient and grounded therapist. And my goal as a therapist is to continue to improve the lives of individuals, promote and encourage change, and help people feel empowered. Thank you. And here are the references, and I'll leave it here for a couple minutes before I end it. Thank you so much.